Hi everybody, this is a video about comparing the difference between Bartonella and Epstein-Barr virus. Just before I get into the nuts and bolts of the little video here, if you could just please take a second, if you don't mind, just to like or share or subscribe or comment on this video. Even just a quick comment like, thanks for the video or something to that effect would be great. Just helps to boost my rankings in the algorithm and just gets more folks exposed to this content. So if you find it to be useful, then more folks will be able to access it too. So thanks in advance for taking a second to do that. So somebody posted a question on one of my other videos, essentially saying, my Epstein-Barr virus levels are off the charts high, but I'm wondering if I might have Bartonella. And essentially the gist of it is, could my symptoms be due to Bartonella, or maybe it's all due to Epstein-Barr virus? So thank you for the question. As per usual, I can't provide any medical advice over social media. This is for informational purposes only. If you have need for medical advice, please talk to your healthcare provider to get that advice. So when we look at the list of symptoms that can be caused by a chronic viral infection with, say, Epstein-Barr virus versus Bartonella, there's a ton of overlap. Spoiler alert, there's a ton of overlap with any type of chronic infection. There's actually a ton of overlap with mold illness and heavy metal accumulations and a variety of other things as well. So there's a lot of overlap with a lot of these chronic causes of chronic illness. But just using Epstein-Barr virus and Bartonella as examples, so they can both cause fatigue, they can both cause pain in muscles and joints and throughout the body. They can both cause neurological issues. They can both cause symptoms that might look like autoimmune type conditions in folks who don't have any markers of autoimmunity, but they have the symptoms of autoimmunity. So there's a whole bunch of overlap between what Bartonella and Epstein-Barr virus can cause. Now, Bartonella is known to, in not all patients, but in some patients, like a significant number, to have some kind of quote-unquote special symptoms that cause it to stand out from other infections. So, for example, Bartonella can cause a lot of lymph node swelling, or lymphadenopathy as it's called. Now, chronic viral infections can cause that too, but it's maybe more commonly associated with Bartonella. Bartonella is also known to cause sometimes terrible neuropathy, especially in the feet. Viruses could potentially cause that too, but Bartonella is kind of known to do it more. And then Bartonella can, and this isn't common, but it certainly does come up in some patients, can cause these inexplicable stretch marks, or what look like stretch marks or scratch marks on the torso, kind of these, as they call them, longitudinal striations. So usually like a reddish or purplishy kind of color to them. So if those symptoms are present, it seems a lot more or it would increase the likelihood it might be something like Bartonella. But for other more generalized symptoms, could be Bartonella, could be Epstein-Barr virus, or in many cases it could be both. Epstein-Barr virus, as I discussed in quite a bit of detail with one of my previous guests on my Overcoming Chronic Illness podcast. If you didn't know, I have a podcast. It's called Overcoming Chronic Illness. I've had about 10 interviews to date with various clinicians and other experts in the healthcare field. So I think it's been a great podcast. It's been a great experience for me. I've learned a lot so far. But I had an interview with a fellow naturopathic doctor, Dr. Casey Holland, maybe a couple of months ago. And we talked a lot about something that she sees in practice, something I see in practice, a lot of us see in practice, that if we see Epstein-Barr virus reactivation, well, the question should really be, why is it reactivated? If we're just going after the Epstein-Barr virus and antivirals, and we're not looking at the root cause factors that allow that reactivation to occur, we're going to swing and miss a lot of the time with those types of protocols. So there could be a scenario where there's Bartonella that has enabled the Epstein-Barr virus to get reactivated, or in some patients there's a mold exposure and that causes the Epstein-Barr virus to get reactivated, and maybe Bartonella comes on the scene as well. So there can be multiple factors. Fortunately, at least in my experience, there are a lot of the agents, the antimicrobial agents that we would use to treat Bartonella will also have antiviral activities as well. So for example, Chinese skullcap is a good anti-Bartonella herb. It happens to be a really strong antiviral. There's an herb called Isatis, which is a good anti-Bartonella herb. It happens to be a strong antiviral. So you can use a lot of these multitasking herbs and other products and whatnot to try to tackle two birds with one stone. Or as one of my previous podcast guests, Dr. Jill Krista, said, you can feed two birds with one seed, which is a much more pacifist way of using that saying. Those poor birds, let's feed them with seeds, not hit them with stones, unless we're really hungry and we like chicken, for example. But there's a little carnivore diet plug there. So there can be a lot of overlap, and it can be very difficult to tell clinically whether symptoms are being caused by Epstein-Barr virus or by Bartonella, and in some cases it could certainly be both. So where does that leave the patient? Or if I have a patient where I suspected one or both issues, will I be using those broad spectrum antimicrobials, and then also just making sure that I wasn't leaving any stones unturned around root cause factors. A lot of my patients with those types of infection issues, they either have, again, underlying mold exposure. Sometimes it's a heavy metal thing. Sometimes their methylation cycles are all clogged up, and we need to get their detox pathways working properly. Sometimes it's related to gut issues. They had chronic gut issues for decades and then started to develop other systemic issues, and said, well, if we don't go back and fix the gut first, it tends to be quite a steeper hill to climb to get over those chronic infections. So there's a lot that goes into it. It's complicated, and which of course is why it's important to ideally, if feasible, work with a doc who's well versed in these things and can help navigate the waters of complex chronic illness. So thank you for the question. I hope that this information was useful. If anybody has any questions about this topic or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.